Good evening, everyone. I'd like to welcome you to our webinar tonight, Preventing and Detecting Colon Cancer During the COVID-19 Pandemic. We have a great presentation prepared for you this evening. Our agenda, I will do the welcoming and introduction. We have Dr. Bratcher and Roche speaking on colon cancer awareness and screening, nutrition and cancer awareness from Michelle Nash, our registered dietitian, and then we will conclude with some questions and answers. Please enter your questions into the question and answer tab into your Zoom window at any time. Please include the presenter's name in the parentheses after your question so we know who you would like to present your question to for a response. We will answer all questions at the end of the presentation. We will share the presentation recording with all attendees in a follow-up email. I'd like to discuss, first of all, COVID safety at Berkshire Medical Center. We test all patients 3 days prior to coming in for the procedure. Anyone undergoing a procedure needs to have a negative COVID test. All staff follow strict infection control guidelines with hand washing, masking, gowning and gloving, and we have strict cleaning protocols between all procedures. We limit visitor access to prevent exposure, and the majority of our healthcare workers have all been vaccinated. Please welcome Jason Bratcher, our Chief of the Division of Gastroenterology at Berkshire Medical Center. Dr. Bratcher, originally from Artesia, New Mexico, came to Berkshire Medical Center in 2015 after completing his residency, fellowship, and 7 years of practice in New York City. His clinical interests include interventional gastroenterology, pancreas disorders, and liver disease. Thank you, Dr. Bratcher.
Thank you, Jackie and Jennifer. I want to just thank everybody who made it possible for us to do this presentation tonight. So as the first slide shows, March is Colorectal Cancer Awareness Month. So we're really pushing everybody to get screened if you haven't already, or to educate yourselves about what you need to do to get screened and when. So basically, I'm going to tell you a few facts about colon cancer, but the thing that we need to start with first is, what is the colon? So a lot of people don't really understand the anatomy, so I just wanted to review very basic to begin with. So the colon is the large intestine. It's the lower part of your digestive tract, and it's responsible for several things. Obviously, elimination of waste products from your diet. It contains billions of bacteria that help with absorption of specific types of vitamins, nutrients, and also liquid. And this is what we get a lot sometimes, like, well, what is the rectum? Well, the rectum is just basically the lowest part of the colon. It's the last portion of the colon before elimination from the colon. And it's important because if cancer develops in that area, the treatment could be just a little bit different than if it's higher than the rectum. So now, we get this a lot as well. How does colon cancer develop? So basically, the vast majority of cancers in the colon develop from polyps, and specific types called adenomas. So you may hear that term when you meet with your provider, your gastroenterologist, talk about adenomas. So these little growths from the wall of the colon start developing and start growing over time. And there are different types of polyps of the colon. There are flat ones, what we call sessile polyps. There are pedunculated, but essentially these are the things that we want to get to and remove to prevent cancer from developing. Because again, over time they can turn into cancer. Now this picture just kind of shows the development of cancer over time. So basically on the left side of the screen, you have very, very small early polyps that start growing over time. And again, it takes about 10 years for a polyp to turn into a cancer. So if we can get the polyp at this spot, you're good. Remove the polyp, it prevents cancer from developing. But we don't want it to turn into this. And this is where colonoscopy is very important, because we can get the polyps out before they turn into a cancer. Now, who gets polyps and cancer? So basically, the #1 risk factor is age. As we get older, polyps become more prevalent. So you can see that in your 20s and 30s, only about 4% of people get polyps, but you can. Doesn't mean that you don't need to be watchful of symptoms. Between the ages of about 20 to 30% of people will have polyps at the age of 50, and then over 50% of people at the age of 70 will have polyps. However, this is changing. In the younger population, younger than 55, there's an increased risk of developing polyps, and that will change our guidelines, and Dr. DeRoche will talk about that in a minute. As far as predilection based on gender, basically, men have a slightly higher risk than women, but for the most part, they're pretty similar. So we recommend screening in everybody. Doesn't matter what your gender is. Blacks have a higher rate of polyps and cancer, so we recommend screening the Black population earlier as well. Patients who have obesity also have a slightly higher risk of developing polyps and cancer, and also family history. So about a third of patients have family history of colon cancer, but this is important because 2/3 of patients do not. So the vast majority of patients who develop cancer do not have family history. So don't think that just because you don't have family history, you shouldn't get screened. That's not accurate. The more family members that you have, the higher the risk that you're could develop cancer as well. There are also some inherited syndromes. One called Lynch and another one familial adenomatous polyposis. There are also risk factors, as well as other medical conditions, specifically inflammatory bowel disease, ulcerative colitis, and Crohn's disease. This does increase your risk of developing colon cancer over time, so you need to have surveillance of that more routinely than the general population. Then also, type 2 diabetes. There's data saying that this can also increase the risk for polyps and cancer. So what are symptoms? So again, this is a very important slide that most patients with colon cancer have no symptoms when they're diagnosed. Again, most patients have no symptoms. So this is why it's important to get screened. Now, those who do have symptoms could be rectal bleeding, or you notice some blood in the stool, could be an alteration of your bowel function that's apart from your norm, unexplained weight loss, new onset constipation, or diarrhea. So these are just some of the things that patients who have colon cancer may develop. But again, the large majority of patients don't have symptoms of cancer when it's diagnosed. Now, these also could indicate other issues are going on. So it's important to have that conversation with your physician if you're having any symptoms, and also to talk about the age that would be appropriate for you to get screened. Now, we're going to turn it over to Dr. DeRoche. Thank you.
I'd like to introduce Dr. DeRoche. Keisha DeRoche is a board-certified gastroenterologist and hepatologist trained in New York City. Dr. DeRoche studied at St. George's University School of Medicine in Granada, completing her residency in internal medicine at Lincoln Medical Center in Bronx, New York, and Metropolitan Hospital Medical Center, New York, New York. She is fellowship trained in gastroenterology from SUNY Downstate Medical Center in Brooklyn. Dr. DeRoche has performed extensive research in the field of gastroenterology and published is published in many well-known journals. She is also fluent in spoken and written Spanish. Welcome, Katisha.
Thank you so much, Jackie, and thank you to the organizers of this program for our community. Okay, so a few basics about colon cancer and what are the statistics. Basically, the projections for 2001 is that it's the third most common cancer diagnosis that patients will get. It's the second most common cause of cancer death. And over 100,000 new cases of colon cancer will be diagnosed this year. And over 45,000 new cases of rectal cancer. So the lifetime risk of colon cancer is basically 4.3% for men and 4% for women. So it's not that much different in both genders. And the projected cancer death for this year is over 50,000. And again, that has to do with part of it having, all of the screening from last year not being able to be done. And the rate is increasing in the younger population. That younger than 55 increased by 1% per year from 2008 to 2017. And of course, we want to sound the alarm on screening earlier. So, according to the CDC, 50 to 60% of colorectal cancer deaths could be prevented if all persons aged 50 or more were screened routinely. How can you prevent it? You have to get screened. Do not wait until your symptoms, that you have unexplained weight loss, you have some form of rectal bleeding, you have changes in your bowel habits. Don't wait. As soon as you're able to be screened with a colonoscopy, we urge you to get screened. So at what age can you get screened? So prior to 2020, an average risk patient began screening at age 50. And of course, for Black Americans, age 45. Now, if there is a family history of colon cancer, then we recommend 10 years younger than the first degree relative or starting at age 40. And that would be whichever one of these, comes first. I want to bring your attention to the fact that the guidelines are currently changing. We would likely start recommending screening at age 45 due to increased risk of colon cancer in younger patients. But again, those guidelines are just starting to roll out, so stay tuned. There will be more updates regarding this, but we're on the ball to start screening beginning at age 45 for everyone. The recommendation is basically for screening to be continued through age 75 if the screening protocol is up to date for every patient. And we can consider screening for any patient after age 85. And that is to say, if the patient is, someone who is very active and has, very good lifestyle, we sometimes recommend that once, we have a discussion with the patient and they have agreed. So this can be done. Now, there is some recommendation to discontinue screening in patients with shortened life expectancy, less than 10 years, if they have less than 10 years of anticipated life remaining. So, for example, for patients who have unfortunately some form of metastatic cancer, which is metastasized all over the body, sometimes we recommend, if they do not have more than projected 10 years to live, then we sometimes would recommend that the goals of care be discussed and that we take into consideration if they would be a candidate for screening. So what are your options for screening? Basically, your colonoscopy is your gold standard, and we want to recommend it as the first line test for screening. It's done every 10 years unless the patient has some form of high-risk polyps. Then we can provide an interval of 3 to 5 years, and that is going to be based on the type of polyps that we took out at the time of the colonoscopy. But if there was no lesions that were found on the colonoscopy or very benign polyps, then the interval can be every 10 years. There's stool-based test, which is the FIT test, but this is a test that needs to be done every year, and I just need you to know that with the Cologuard, these are not very good for polyps because they cannot detect all of the polyps that will be required to be removed. And again, with a stool-based test, remember we have no way of removing those precancerous polyps. Another test that we can sometimes use is what's called virtual colonoscopy. It is a CT scan of the colon, and it's diagnostic, but it, again, cannot remove polyps. So I want to stress again that your best bet would be your colonoscopy. How is this performed? It's outpatient procedure. It's same day for a couple hours. You will do the preparation the night before. You will have anesthesia, so you'll be very comfortable during the entire procedure. And it's very safe, but there are rare complications that can sometimes happen. They don't happen very often, but of course they can. So what can you expect from us here at Berkshire? We offer a very safe environment for the procedure, like the other speakers ahead of me reiterated. A COVID testing is done on every patient before all procedures, at least 3 days before. There's excellent, highly trained, very nice, amazing clinical staff that is available for you. High standards, 1 minute, state-of-the-art endoscopy unit. And all of our gastroenterologists who perform these procedures are all board certified. Detailed information about the procedure and preparation, we'll give you that all ahead of time. Our clinic staff is very good at that. And all questions will be answered by all of our staff. And of course, every single patient is treated with the utmost care and respect. We speak to you before the procedure, we speak to you after the procedure, and we tell you when we will get back to you in terms of when your next colonoscopy should be. Okay, so what do you do if you would want to schedule a colonoscopy? Well, you will talk to your primary care doctor about a referral to our office. We're located in the MAC building on the 2nd floor. And you can feel free to contact our office as well with any questions that you may have. It's, of course, the Division of Gastro. This is our number 413-499-8590, and then you can speak to one of our office staff regarding this. Okay. All right. Thank you.
Thank you, Dr. Roche. I'd like to next welcome Michelle Nash. She is the oncology dietitian at our BMC Cancer Center. Michelle is the dietitian at the BMC Cancer Center, she brings us her passion for healthy eating and nutrition as a vital part of medicine to her patients with individualized nutrition counseling during and after cancer treatment, and to the community at large with cooking demonstrations of her easy and delicious recipes. After earning a bachelor's degree in nutrition science at Cornell University, she went on to complete her master's degree in nutrition science at the Sage Graduate School in Troy, New York, while performing her dietetic internship at St. Peter's Hospital in Albany, New York, where she focused on oncology. In her free time, Michelle enjoys running and hiking in the Berkshires and trips to Chocolate Springs. She is here to share her anti-colon cancer nutrition tips as well as her favorite anti-cancer recipes. Thank you very much, Michelle.
I should be a dietitian for the chocolate spring.
I know. I've heard that.
We get to see that.
Also, we can't see this.
Michelle, can you hear me? Because we can't hear you.
All right. So, is that better? Can you hear me now?
Yes, we can hear you now. Thank
Okay.
you. So sorry.
No worries. These technology glitches happen in the world of COVID, but I'm really excited to be here today and to share with you my colon cancer or anti-colon cancer recipes. One of my favorites being shrimp tacos with a lime crema sauce that I'm going to show you how to make today. So in terms of nutrition and anti-colon cancer, there are a few really easy things that you can do in your diet to really improve your health and decrease your risk. So one of the things that you can do is increase the vegetables and overall the plants in your diet. So this recipe, we start with a dressing for our tacos, and adding some fruits into the savory dishes that you do is a really great way to add some extra antioxidants. Now, antioxidants are really helpful because they help your immune system get rid of things called free radicals, which kind of run around the body and make mischief. So Dr. Bratcher was talking about those polyps that form. Free radicals can sometimes be involved in that. So getting as many antioxidants as you can is a really good idea. Now, how do you do that? By eating a lot of plants, because your fruits and vegetables and your plants, they're where you get the most antioxidants. So right now I've just zested and I'm squeezing my orange because this is going to be the base of my dressing from the tacos. So we're going to have not only an orange, we're going to be using this Asian style slaw here, which I'll show you in a moment. And it's delicious. It has some cabbage in it. It has different colored cabbages. It has some carrots in it. So it has a lot of different vegetables. Now, I love using things like this for a recipe because it's basically already cut up, already prepared for me. You just buy it in a bag in the store. Very easy. I don't need to take my cabbage and shred it or anything. So I'm also getting a number of different types of vegetables already just in one fell swoop, if you will. And that also makes it really easy. So to continue with the dressing, I use a low sodium soy sauce. And I like using the low sodium because you get a good amount of the flavor, but you don't get all that added salt. This is actually going to be the salty element in the dish, so I'm not going to be adding any additional salt. I have some fresh ginger here as well. We're going to be using this in both recipes we do today. And the fresh ginger is, again, that's a powerful antioxidant. So when you're using your herbs and spices, they play a role in helping your body be healthy. Now we're doing shrimp tacos today because one of the recommendations nutrition-wise for an anti-colon cancer diet is to decrease the amount of red meat and especially decrease the amount of processed meats. So that's why it's shrimp today. I love using frozen peeled shrimp. I take what I need out of the freezer and thaw it and use it, put the rest back. It's an easy thing to do and to add to a grocery list, especially if you want to kind of be in and out of the grocery store really quickly during the pandemic. It's really nice to grab some of these packaged foods that are really just like one step away from being prepared already and have them on hand so that you aren't dependent on always going to the grocery store. So I've added some of that dressing that I made, which again was just like orange juice, some soy sauce, some fresh ginger, And we're gonna let the shrimp soak in it for a little bit and get our burner on here. And then the rest of the dressing goes on top of our slaw. And this is going to sit for the remainder of the demo until we're done and ready to make our tacos and just get a really nice flavor going through there. Now, what you can do, if you wanted, is you can add something like sesame seeds. So sesame seeds or other nuts and seeds are a great source of healthy fat. And your healthy fats, like nuts and seeds, avocado, olive oil, they are anti-inflammatory. And your healthy fats are another really important aspect of an anti-colon cancer diet, because your healthy fats, because they're anti-inflammatory, they help the immune system kind of seek out and destroy those cells that might be causing mischief. So you can think about it this way. If you have a high level of like background inflammation, your immune system can't really see what's going on. But if you eat an anti-inflammatory diet with lots of vegetables, healthy fats, whole grains, fruits, low red meat, then your immune system can see. So that's a nice way of thinking about kind of why you'd want to be doing this sort of thing and having tacos on a Tuesday. So our slaw is all mixed and we added that extra bit of sesame seeds in there. So that's going to sit here while I get my pan hot so we can start cooking the shrimp. So I have here, I use a whole grain corn tortilla, and I've actually prepared some ahead of time here, cooked them up so that we can just make our tacos. I love using a whole grain. So there's whole grain wheat, or you could have a corn tortilla. Whole grains they have more vitamins and minerals, which is really good. And they have more fiber, which is also really good. So you do want to incorporate whole grains whenever you can. Whole grains instead of refined grains. Refined grains, whenever you see the ingredient like enriched flour, that's going to be a refined grain. So just make sure that at least half the time you're doing a whole grain product. Now, I get the question, so like, okay, vegetables are good, right? You know, that's what my mom told me, but why? So glad you asked. So one of the reasons why vegetables are so good, there are two really big reasons. One is that, you know, your colon is where your waste, a big portion of your waste is, and nobody likes it when the trash hangs around too long, you know. So fiber helps the body get rid of those things that it's that it wants to get rid of. And the other reason is that those, pardon. So Dr. Bratcher talked about the bacteria that's in your colon and the things that they make. So the fiber that you eat feeds the good bacteria in your colon so they can make those little molecules that keep the colon healthy. So when you eat vegetables like our cabbage slaw here or some broccoli, you're feeding your good bacteria, and in return, they're giving you presents back, which keep your colon healthy. So it's a win-win, right? Win for you, win for your bacteria. And there are certain vegetables that do that more so in the colon than others. And those are the ones in the cabbage family. So broccoli and our cabbage here. That's why I'm doing these recipes today. And speaking of broccoli, I want to get my second dish, our side dish here going, which is a garlic and ginger broccoli. So our garlic and ginger broccoli is a really great way to have a very flavorful, very fast side dish. And since I'm kind of going with like an Asian style taco, it plays in, those flavors play in really well. It's going to be some garlic and again, the ginger, which I have over in the taco as well. And again, anti-inflammatory. And that's really going to give us a nice theme throughout. And it's really easy to do. So when you get ginger in the store, I like getting, just a piece of ginger root. It freezes really well. So when you get some, you can grate it all up and store it in a container in the freezer. And the antioxidant value of your ginger stays the same. So, it might decrease a little bit, but practically the same. So you don't always need to be running out and buying fresh ginger again and again. You can have some on hand. Same with like what we're doing with the shrimp. So with the ginger garlic broccoli, I'm going to use some olive oil. I buy it in bulk because I use it all the time. If you are using an oil, I do really, really recommend that you get olive oil. And one of the reasons is that it's a very healthy oil, and saturated fat, which you find in butter or coconut oil or your red meats, that's more pro-inflammatory. And so there is an association with diets high in saturated fat and certain types of cancer. So just to be aware, you can pretty much use your olive oil wherever you'd want to use an oil. I've even put it in cakes, but that might just be me. So with our olive oil in the pan here, I'm going to add some garlic. Now, I love using the garlic that you just get in the jar for a couple of reasons. One is I don't have to deal with peeling and crushing cloves of garlic because I just don't like doing that. I find it really annoying. The other reason is that garlic is one of those vegetables that is especially anti-cancer. And if it is aged, so if you cut it and kind of leave it exposed to the air for more than 30 minutes, it actually increases the potency of that anti-cancer activity. So if I get this already minced up garlic that's in a jar with some water and a little vitamin C, this is actually more anti-colon cancer than if I had just chopped up some fresh garlic right here. So I really like that aspect because it saves me time and I get more benefit out of it. So I'm just putting the garlic here in my olive oil, getting that going. And I'm going to add the rest of my ginger. Now with the broccoli, I have blanched this broccoli here. Now what that means is I cut it up and I boiled some water and then I dunked the broccoli in. So that started the cooking process. And after about a minute, I took it out and put it under cold water. And that stops the cooking process. And it's a great way to get your broccoli tender, but preserve all the nutrition in it. Because I haven't boiled the broccoli, so the nutrients haven't leached out, but it's going to be really quick to get it hot all the way through so that we can enjoy this. So our garlic and ginger is sauteing here. I'm going to add the broccoli, and I just want to toss it through here. Now, since there isn't any salty element here, I am going to add a little bit of salt. In general, I don't salt things if I'm adding a salty element, like my soy sauce, or if I had olives or capers in a recipe. But if it's just a few ingredients, I will add a little bit of salt. So our broccoli is getting going, and I told you all about how it's super good for your colon, and it's going to feed those little bacteria, and they're going to be happy and give you presents. And I talked about the healthy fats. Now, I do want to touch back on the red meat aspect. So that's something I get that question a lot, how much red meat is too much? How bad is bacon? It's so delicious. So really, there is a strong link between processed meats. So these are meats that, especially processed red meat. So this would be bacon and sausage, bologna, salami, and an increased risk in colon cancer. So you really want to reduce those and think of them much more like an occasion food. So this would be something that you would have once in a while, and you wouldn't make it a part of your regular diet. I sometimes get the question, oh, what about turkey bacon? That's actually, it's really not that much better. It's still aged. There's a lot of nitrates and added to it. And the nitrates are one of the aspects that contribute to increasing colon cancer risk. So I would say look at it as an occasion food, something that you don't seek out. Red meat, the American Cancer Society recommends less than 18 ounces of red meat per week. Now there's 16 ounces in a pound. So that's actually, I would say 1 to 2 servings a week is still within that limit. But the more plants you can have in your diet, the better off you are. Now, another reason to decrease your red meat is the more fish you have, that has been shown to be associated with a lower risk of colon cancer as well, in addition to a lower risk of heart disease, especially if you're eating a fatty fish like salmon or sardines, those kind of cold water fatty fish. And they're really high in protein. And I think they're easy to cook. And with the recipe packet that you will be getting, you'll see that there's, I don't think I have a single red meat recipe in there. And I definitely have some with plants. A plant-based protein would be a legume, again, very high fiber. That might be a chickpea, a black bean, something like that. And they're very filling and really, really, really high in antioxidants because they're plants. So you really can't lose with those. What's great is that they're also inexpensive, and canned is just as good as if you were to soak and cook your own. So with thinking about, decreasing time in the grocery store, shopping less often, some canned beans can really make some of the foods that you have stretch farther so that you're decreasing your exposure and being really good at increasing your antioxidants and helping your immune system. So moving on to the last little dish that we're going to do, this is my take on a crema sauce, which is usually made with sour cream. And today I'm going to make it with Greek yogurt. Now, I love Greek yogurt because it's high in protein and high in calcium. Calcium is very important, and you really want to make sure you're getting enough calcium because that can help decrease your colon cancer risk as well. So adding Greek yogurt instead of sour cream here, we're going to be getting a good amount of protein and calcium without that added saturated fat, which I mentioned isn't so good for colon cancer. So basically it's, since I'm just making tacos for one here, it's just a couple tablespoons of the Greek yogurt. And I'm going to squeeze 1 lime in there. Again, fruit, more antioxidants. Sometimes you don't get much juice out of a lime. I may have to use a second. And I also have have some cilantro chopped up. Now, some people don't like cilantro. That's fine. You could use a little hot sauce or something else to give it a little extra flavor. I do like cilantro, so I'm going to use that. Using fresh herbs is another way to increase your antioxidants, and it's a great way to add additional flavor without additional calories. Now, as Dr. Bratcher mentioned, a weight that is overweight or higher is associated with an increase in risk of developing colon cancer, among other cancers. And using things that can decrease the calories, but not the volume of what you're eating, is a really great way to still feel full and not be overeating. And that's exactly what we're doing here. So actually everything is done now. So I'm going to start putting together a taco, and I'll walk you through how this is actually a very high nutrient, high volume, and low calorie dinner. So I have my taco shells here. So we're going to fill them with some slaw. Now the cabbage slaw, cabbage, very low calorie. We have a dressing on it that was made with fresh squeezed orange juice. And we already know that this is really good for our colons. And so already not very many calories. We're going to add some shrimp, high protein, which is very satisfying. Again, pretty low calorie. And our lime cilantro crema, instead of being made with sour cream, it's made with Greek yogurt. So we have, I did the nutrition facts on all my recipes, so I do need to pee. In 2 tacos, you're going to have about 20 grams of protein for 330 calories, which, given that the average American needs between 15 and 2,000 calories, depending on your age and activity level, that's pretty good. In fact, it's pretty awesome because you can have a bunch of them. And with the broccoli, we're going to be filling up the plate. You'll feel really full, and with all that fiber, you're going to feel really satisfied. So that is the tacos. Now, something that I also get asked a lot is, well, what about treats? Now, I have some recipes for a few little nibbles that I think are really delicious. And one that I've actually made today is the Tamari maple syrup glazed almonds. So you roast almonds in the oven. You want to start out with some raw almonds. Again, healthy fats, and almonds are actually high in calcium as well. So you sort of have that double benefit from them. And then when they're done and they're nice and hot from the oven, you then add your tamari and your maple syrup and toss them through. The hot almonds absorb it and they get really nice and glazed. They're delicious and they make a really nice snack. Very satisfying, very healthy, and super easy to make at home. Now, one other point that I do want to bring your attention to is alcohol. Alcohol is one of the, I don't know if you could call it a food. It's one of the dietary elements that you really do want to reduce because there is a known link between alcohol consumption and at least 7 types of cancer, colon cancer being one of them. So think the same way like with bacon or processed meats, think about alcohol as an occasion. sugar. Now, sugar is delicious, but it is pro-inflammatory. It also has been linked with heart disease, weight gain, diabetes, which we know can be diabetes and weight gain can be risk factors for colon cancer as well. So the fact that it's really on that pro-inflammatory, that disease promoting aspect of what a diet can contain, you do want to limit it. So again, have it occasionally. You know, I added some maple syrup to the nuts here, but make it much more of a treat food, and then you will enjoy it more. So I do hope that you enjoyed. I hope that you have some really good questions, and I look forward to seeing what you have to say. Thank you so much.
Get back to our presentation. Michelle, would you walk us through your summary of the good foods and the foods to avoid?
Absolutely. So in summary, the foods you do want to include and eat more of: vegetables, like I mentioned, and your fruits. Especially in thinking of your vegetables, you want to concentrate on those broccoli, cabbage, that family of vegetables. You also want to eat a lot of fiber, and that is so that not only is the waste moved out, but your bacteria are fed good things that they like to eat, and they give back to you. Now, legumes, so that's your beans and peas and lentils, black beans, kidney beans. Nuts and seeds, like our sesame seeds and almonds, whole grains, and we had our whole grain corn tortillas. Those are excellent. You also want to concentrate on healthy fats. So moving away from those animal-based fats, and definitely away from anything that has trans fat in it, and going for olive oil, nuts and seeds, and fatty fish. Speaking of fatty fish, and increasing your fish as opposed to your red meat is one of the things you want to try to do in your diet. And then I did mention garlic specifically because of those really great bacteria feeding compounds in garlic, which really help with keeping your colon happy and healthy. And then getting enough calcium and vitamin D. Now, most dairy foods are fortified with vitamin D, but talk to your doctor about getting a vitamin D level drawn and seeing if you may need to supplement. Because we live so far above the equator, the sunlight is really only adequate from about April, May to maybe October for our skin to actually make vitamin D. So there's a really good, 6 to 8 months in the year where we can't make enough vitamin D just based on the sun, even if we're outside, just because of the angle that we are. And so, yeah, talk to your doctor about possibly supplementing. So those are the foods that you want to increase, and the foods that you want to decrease, as I'd mentioned, your processed meats, and those include hot dogs, sausages, cured meats, bacon, hams, those kinds of things, and your red meat overall. Now, I do get the question a lot is pork red meat, right? No, it's the other white meat, right? That's actually just marketing. Any of your four-legged critters, cows, pigs, sheep, venison, anything like that, that's all red meat. So that's all included in that sort of, you want to be below, I usually say below 16 ounces. That keeps you on the safe side. So alcohol is another element in your diet you do want to have occasionally. And again, if there's an occasion, an anniversary, and a birthday, absolutely, have a glass of champagne, but it really shouldn't be an everyday thing, because that really increases your exposure. Now, your saturated fats, especially your trans fats, you want to reduce, and you can figure out if a food has trans fats in it by reading the label. If it says anything about hydrogenated or partially hydrogenated, that is going to be a trans fat, and you really want to avoid that. And then, as I finished up with sugar, you do want to decrease your sugar intake, and because it is pro-inflammatory and it just increases that disease process.
Thank you, Michelle. That was terrific. You've got us all starving. Everything looks awesome.
I just wish you could all smell it, because the garlic and the ginger broccoli is literally, it's one of my favorite dishes, and but when the pandemic's over.
It all looks so good. Thanks so much. Now we're going to go on to some questions. Michelle, is chocolate healthy?
Oh, I love chocolate. This is one of my favorite, it's actually one of my favorite questions. So this is a perfect example of that, how to have something occasionally. Now, I would highly recommend including chocolate in your diet in moderation, and going for a more expensive and higher quality chocolate, a darker chocolate. You're going to get antioxidants. Now, if you're spending more money on it, you're going to eat it less frequently, and it's really high quality, you're going to enjoy it a lot more. So really, you're getting some health benefits. Your portion is limited naturally, and your enjoyment is even higher. So you really can't lose.
That's right. You told us you were a big fan of Chocolate Springs.
Absolutely.
I have another question from the audience. Michelle, how do
Yes.
we get your recipes? And you're adorable, this audience member said.
Oh, well, thank you so much. The recipes are going to be emailed out to you at the end of the presentation. And if you don't receive them, you can there's a contact number for the Cancer Center. You can let us know, and I can send them to you.
Okay, great.
Thank you.
Next question is for Dr. DeRoche. Do we know why younger population is having an increase in colon cancer?
Okay, thank you for that question. So we don't know why. That's the true answer to that question. I think what has happened in the past years is that there has been a composite of studies which have shown, because we've had so many younger patients being diagnosed with colon cancer. I know you would have remembered Chadwick Boseman from one of the stars of Black Panther, the movie Black Panther. And over the years, there has been a big push because colon cancer in younger population has gone unnoticed. And so they have determined that if we start screening at age 45 as opposed to age 50, that we can catch, a whole lot of people within that age group and, have better outcomes. So the answer is no, we don't know why, but the composite studies that have been done have been shown, we should probably start doing this a lot sooner.
Thank you very much, Dr. Roche. The next question is for Dr. Bratcher. Why would someone with precancerous polyps be told they need another colonoscopy in 7 years rather than the 3 to 5 years that was mentioned? Dr. Bratcher.
Thanks for that question. Excellent question. So the guidelines for screening and for surveillance, once you've had a colonoscopy and found a polyp, get updated every few years. So the most recent guidelines changed in that if you only have 1 or 2 very small adenomas, precancerous polyps, then it's actually safe to wait 7 years. The guidelines, again, have changed. And we know now from long-term studies that it takes such a long period of time for polyps to turn into a cancer that waiting the 7-year period at this point, is probably fine. But obviously you want to watch for any sort of symptom. And again, those guidelines may change again in the future. Thank you.
Thank you, Dr. Bratcher. We've got time for 1 or 2 more questions. I've got another question here. This is for Michelle. The American Medical Association guidelines say up to 1 alcoholic drink per day for women and up to 2 for men, but that is not in accordance with your presentation. Michelle?
Yeah, so that's a great question, and it does need a little bit of explaining. So it is up to 1 drink per day for women and up to 1 drink or 2 drinks per day for a man. So that's not to say that that's how much we should drink. And when these recommendations are being crafted, there's a lot of special interest groups that have a say in it. So if just the medical community was able to say, this is what we think people should do, the alcohol recommendations would be a lot lower. Now we have the Alcoholic Beverage Association, and they put pressure to have at least a recommendation for alcohol consumption in the guidelines that are put out. So unfortunately, that is how these recommendations are hammered out. That's just the way it is in this country. But really to read it as that is a maximum that is considered to be allowable to have the least amount of risk. So the way I look at that is there is risk associated with consuming alcohol. I mentioned it's associated with an increased risk in 7 different, if not 8 different types of cancer, colon cancer among them. So it's really in your hands about how much are you going to be adding on to that risk, or is that something that you say, okay, I'm going to limit myself to 1 drink every so often and make sure that you aren't contributing to that increased risk. So I hope that answered your question. It's a little, more than nutrition is with that.
Great. Thank you very much, Michelle. I'd like to take this time to thank the audience for participating. It was great to be here to present this presentation from our audience, Dr. Bratcher, Dr. DeRoche, and Michelle. Thank you very much. And there'll be no more questions. Thank you. And I'm going to go to our last slide where we have our contact information for anybody in the audience. And I would like to stress, please don't forget, if you have not gotten your colon cancer screening, and colonoscopy is the best gold standard for cancer screening, colon cancer screening. Please get screened. That's our message for tonight. Thank you.